I want to share something I haven't talked about publicly before, not because it's a secret, but because I wasn't sure it was mine to share. And then I realized the things I've been through with my dad are exactly what most of you are going through or heading toward. And if my story helps you feel less alone in yours, then it's worth saying it out loud. I'm Slava, a nurse practitioner and a daughter. And today I'm going to lean much more heavily on the daughter part. Stay with me, because at the end of this video, I want to tell you the one thing I wish someone had told me before all of this started. It changed how I practice. And it might change how you show up for your parent too. In 2022, my father came to the United States from Ukraine. He came as a refugee because of the war. He left everything he had ever known and built his home, his city, his language, the version of his life he'd built over 80 years. And he came here to me. And I remember looking at him when he arrived and thinking two things at the same time. The first thing was, I'm so relieved you're here and you're safe. The second thing, and this is the part I didn't say out loud, was something felt wrong. His legs were swollen, both of them. The kind of edema I've seen in my patients, the kind that doesn't come from a long flight. And he mentioned almost in passing that he'd been having some abdominal pressure. He said it in a way men of his generation say these things, casually, like it wasn't worth mentioning. Like he'd been carrying it for a while and decided it was probably nothing. In Ukraine, during the war, elderly medical care isn't exactly anyone's first priority. So he had learned, like a lot of people, to just push through, to ignore the body's signals, to keep going. And I stood there looking at my father and I felt something I hadn't expected. I felt afraid. Here's the thing about being a nurse practitioner when your own parent gets sick. People assume it must be easier, that your training protects you somehow, that you can just switch into clinical mode and manage it. And it's the opposite. I looked at my father's legs and I didn't see a patient with bilateral edema. I saw my dad. I knew every single thing that edema combined with abdominal pressure could mean. I could list the differentials in my sleep. That knowledge, the thing I've spent 20 years building, became the thing that made those first few weeks the hardest of my life. Because I couldn't unknow what I knew. And if you are watching this, if you are the daughter who has been Googling your parents' symptoms at midnight, I want you to know that the same version of the same thing. You're carrying a knowledge that hasn't been confirmed yet. And that uncertainty, that weight of almost knowing, is one of the loneliest places to be. Now, my father is also a man who avoided doctors all his life. Not because he's reckless, but because where he came from, you didn't go to the doctor unless something was actively on fire. And even then, you might still consider whether to go or not. So I had to navigate something I actually teach about on this channel. How do you get a parent to the doctor when they don't want to go, when they're minimizing, when they've spent a lifetime pushing through? I didn't argue with him. I didn't present the data. I didn't use the clinical voice. I said, Papa, I need you to do this for me because I need to know you are okay. That's it. That's what's worked. We did the labs, we did the imaging, and I sat in that doctor's office with him, not as an NP, not as someone who could read the results before the physician finished speaking, but as a daughter waiting to hear if your father was okay. And he wasn't. Prostate cancer, stage 4. The initial estimate was 2 to 4 months. I'm going to tell you what happened next. But first, I want to pause. Because there is something in this part of the story that I think matters for every single person watching this who is waiting for the results or sitting with a new diagnosis or trying to figure out what to do when the number you've been given feels impossible. When a physician gives you a prognosis, a timeline, an estimate, a number, that number is not a sentence. It's a data point. It's the best information available for that moment based on what's known. It is not a fixed fact about your parents' future. I knew that intellectually as a clinician. By sitting across from my father's oncologist, hearing 2 to 4 months, I had to remind myself of something I tell the families all the time. A prognosis describes what happens on average. Your parent is not an average. So we started the battle, not against the doctors, with them. We asked questions. We pushed for the most aggressive, appropriate treatment. We showed up to every appointment. I was there not as a nurse, not as the one who already knew the answers, but as the person who was going to make sure my father's case got every possible consideration. That's what advocacy looks like from the inside. It's not dramatic. It's not confrontational. It's just consistent, informed, and present. His condition got stabilized. The cancer responded. The 2 to 4 months became 6 months, then a year, then 2 years, and then 2 years later, colon cancer. So yes, we've been through more hospitalizations, more medical appointments, more late night phone calls from nurses at facilities as a clinician and as a daughter, all at the same time. Can I ask you something? Drop a number in the comments for me. 1, if you are at the beginning of this, you've noticed something but haven't gotten the answers yet. Number 2, if you are in the middle, if you have diagnosis and you are figuring out how to navigate them. Number 3, if you've been in it for a while and you are the one holding everything together. I'm reading every single comment and I want to know where you are. If this is kind of conversations you've been looking for, honest, clinical, personal, all at the same time, I'm here for you every week. Subscribe so you don't miss what's coming. Because I have a lot more to say, and I'm finally saying it. I promised you something at the beginning of this video. I said I'll tell you the one thing I wish someone had told me before all of this started. And here it is. I thought that being a nurse practitioner would make me better at this, more prepared, more efficient, less afraid. What it actually did was make me more aware of everything that could go wrong and less able to just be present with my father without running the clinical differentials in the background of my mind. The thing I had to learn, and I had to learn it the hard way, is that your parent does not always need your expertise. Sometimes they just need you. There were appointments where I needed to put down my nurse hat entirely, where the most useful thing I could do was hold his hand and be scared with him, just being his daughter, not his clinician, his daughter. And if your daughter watching this, who has no medical background at all, I want you to hear this. You do not need medical knowledge to be what your parent needs the most. Your presence, the showing up, the holding his hand. That is the job. That is the most important and difficult job. I had to unlearn my way back to that. You already have it. One more thing, and this is the most personal one. My father left a war. He crossed an ocean. He arrived in my living room with swollen legs and stoicism that still astonishes me. And he has fought quietly, stubbornly, in the way men of his generation fight. Through a cancer diagnosis that should have ended things, then through another one, I don't know what the next chapter holds. I don't think any of us do. The uncertainty is a part of the deal. I've made peace with it some days. Other days I haven't. But here's what I do now. The fact that I noticed, the fact that I pushed, the fact that I showed up and kept showing up, that gave him time. And whatever time he has, we're spending together. If you're in the middle of this with your parent, I see the fear, the research, the pretending to be okay in front of them so they don't worry, the worrying by yourself afterwards. I know that life. You're doing something extraordinary hard. And the fact that you are here, asking questions, trying to understand, refusing to just wait and see, that matters more than you know to your parent, even if they don't show it. You are not just a daughter figuring this out as you go. You are becoming someone your parent can lean on, even on the days it doesn't feel that way, especially on those days. Take care of yourself this week, not as an afterthought, as a requirement. Next week, I want to talk about something practical that comes directly out of this story. What to do when your parent arrives in the doctor's office and minimizes everything. How to be in the room in a way that actually helps, without taking over, without embarrassing them, without turning a medical appointment into confrontation. I'll see you there.